Hello ladies, and welcome back to my channel. My name is Aisha, aka Nurse Aisha. Those of you that are regular here, welcome back. If you're new here, you are most welcome to our female to female conversations, where I, Nurse Aisha, will give you information and education from a nurse perspective. Let's get into it. Today's topic is childbirth. Today we're going to talk about everything around your childbirth, when you are actually giving birth. So you have been pregnant for 9 months and you cannot wait to meet your little bundle, or maybe bundles of joy. So the first thing that you need to do is plan. You need a birth plan. Your birth plan is personal to you. You can do this with your midwife, with your partner, and your family. What you need to do is make decisions of how you're going to give birth, when you're going to give birth, where, what kind of music will play. This can also be from a religious point of view or a cultural point of view. You, as the woman carrying the baby, you get to decide this. If you want pain relief, epidurals, not every woman wants this. You need to go through the disadvantages and the advantages of your chosen plan. If you do not have a clear bulletproof birth plan, and this is your first child perhaps, your midwife can help you build up a birth plan. You might want to travel. Let's say you're in Uganda and you want to give birth in the US. What you need to do is to make sure that you have your medical history with you. You have your chart with you. History like vaginal herpes, preeclampsia, if you've had hypertension during your pregnancy. For instance, if you're HIV positive, a vaginal birth might not be an option at times. You might discuss this with your doctor or your midwife, and they will explain to you why this might not be an option. And travel in time. Don't travel last minute. Travel when you have a few months or weeks to prepare yourself and your doctors. Very important to choose a birth plan, because this might also relieve your worries. Now, if it's number 1, there's so many questions. And if it's number 2, number 3, or number 6, then maybe you might not have that many questions. But it's still very important when you're nesting to choose a birth plan. So now it's time to give birth. By now you have your maternity bag ready, and everybody is ready to receive the little bundle of joy. There are 3 stages of labor that you need to know about. The first stage is kind of a long stage. This first stage is also called the latent phase. This is where you start doing everything that you've been learning in the classes. Probably you've taken some classes and you're doing the breathing exercises. Your cervix is now softening and trying to open and dilate. So what is happening is that you start feeling contractions, irregular contractions. So it makes it easier for you to go through the contractions. Now at this point, they're irregular and they're not coming as frequent as they should, meaning that you're not dilated enough. So the baby is still not ready to be pushed out. This could also happen by your water breaking. That doesn't always happen. That's not always the case. But for some women, the water breaks before they even get the contractions. Now, if it's your first child, this could be a long journey. What you need to do is get comfortable. Don't get alarmed. Call your midwife if you're going to have a hospital birth. Start getting your team ready for the massages, preparing you for this amazing journey. So when you're finally done with phase 1, you get into the second phase. And ladies, this is where you're almost there. You have to be patient, keep breathing, and hopefully you are comfortable in wherever you are. So the second phase, this is where you're going to choose a position that is most comfortable for you to push out the baby. your cervix is fully dilated, you are now able to push out the baby. So you choose either to squat, get on a side, get on your back, get on all four if that's comfortable for you. Pushing. You're pushing and you're being told when to push. So if you've done this before, this will not be a surprise. You know, for every contraction, you can push, and then it's very important that you rest in between the contraction. Contractions are very regular and feel more painful, and hopefully, if now you wanted an epidural, it was already inserted. Otherwise, you're doing it natural, without any pain medication, if that's what you have chosen. If you're in your home and having a home birth, you're getting all instructions from your midwife or your doula, if that's what you chose to have. So now we're pushing, and after we're done pushing, we get the baby. So in the third phase, you're done pushing, the baby is out. You have your baby on your chest, and this is when it's time to also push out the placenta. So it can either happen naturally or actively. So actively is when you're given medication for you to get contractions again, so you can push out the placenta. It's very important that this happens within half an hour, so then you can get that out and make sure that it's all out to prevent bleeding. So we just went through the phases of a natural birth, where you actually have your baby the natural way, through your cervix. But during your birth plan, you might have chosen a cesarean or a C-section. A cesarean is a major operation with the same risks as any other operation. So it's not something that you choose out of unconventional reasons. So this has to be discussed with you and your doctor if that is what is going to happen. So basically a cesarean is when you get a cut over your tummy to get your child out without pushing and any contractions. This happens due to medical reasons, most times or sometimes because of herpes, genital herpes, preeclampsia, HIV. This could also happen when a woman chooses a cesarean over a vaginal birth for some reasons, maybe because of fear or just a choice that she has made. But this is important that you go through with your doctor to discuss the disadvantages and advantages of this major operation. So a cesarean can happen electively, basically that you've chosen to have this, it's been planned, probably because of your medical reasons, but it could also be emergency C-section, because maybe your baby's not having enough oxygen, or last minute you realize that the baby is in bridge position, basically with butt or feet first, and that could be risk for the mother to have it, though in some countries usually this is done naturally, but in some countries they choose to have the bridge babies through C-section. So all of this you will have to discuss with your doctor. This major operation happens for a reason, nothing that you choose because you want to or you feel like it's better than having a baby naturally. One part of childbirth that I want us to discuss is postpartum depression or baby blues. This is the part where women suffer in silence after have given birth. All that happens to you through childbirth. You're pregnant for 9 months. Your hormone levels are high, and now the hormone levels are dropping after you've given birth, and you feel low. You feel anxiety. You feel alone. Everything physically and emotionally that can happen is happening this time. You have your little bundle of joy, but you do not feel joyful. You do not feel happy. But it's very important that you talk about this. You don't feel like yourself. You don't have time for yourself. You're supposed to take care of this little person, and you might not even know how to if you're a first-time mother. So you feel overwhelmed. You don't even have time to take a shower. 1 out of 10 women go through the postpartum depression. And it's very important that you know that this is quite normal. It might last a short period of time, but it might also be prolonged depending on if you're asking for help and actually seeking professional help, or you're just keeping it to yourself, thinking that this is your fault. You wanted a baby so bad, now that you have it, you don't feel like it's enough. Make sure you seek professional help for postpartum depression, because there is help that you can actually get. Anything from just talking to your friend will let you know that this is very normal. So part of the postpartum depression or baby blues usually has to do with all the changes that have come with your body, but it could also be the medical assistance that you've received, maybe an epidural. Now all the medication is getting through your system and you feel like you cannot catch a break. So you've gained weight, you probably have stretch marks, you are wondering when you're going to lose the weight, you feel irritated, you're crying all the time. It's very normal. It's going to take time for you to adjust to your new body, to your baby. As it took 9 months for you being pregnant, give it time. It might take the same amount of time to get over this. It's very well known that a woman will feel overwhelmed the first months of childbirth. And if you do need this help, make sure that you seek your midwife or your doctor and you can talk about this. So last but absolutely not least, I would like to introduce a doula. A doula is an amazing professional labor assistant that will help you as a woman through pregnancy, childbirth, the postpartum period. Now, a doula is not to replace a midwife or a doctor, but instead be an extension to a doctor or a midwife. This is such a beautiful profession that I would like to do if I got the chance. I have probably maybe played a doula in some situations, but I'm not a doula. If you're a doula, I applaud you on this. I first heard about a doula through some channels that I follow on social media. This is very popular in communities where there's high levels of child mortality, and according to research, this professional help through childbirth helps keep down the numbers on child mortality and also mortality among women during childbirth. You get so much from a doula, emotionally and physically. Guidance, the knowledge that they have about childbirth and what happens after, what to expect, the do's and don'ts. A doula is a go-to person that I would strongly recommend. A doula could assist you in a home birth. They're very, very good, popular in home births, but also in a hospital. For instance, a doula might assist you during your pregnancy, will come with you maybe to your doctor's appointment, your midwife's appointments, but most importantly, during the childbirth, it's the emotional assurance, it's the physical help, massages in a manner where you feel comfortable. Now, even after the postpartum period, you might get assistance from a doula with breastfeeding and just what to feed the baby. And then together with your doula, you will decide when her duty is done. This is a situation where mothers feel overwhelmed, and now somebody came up with this amazing enlonged hand of the health profession that cannot be there with us all the time. What a doula doesn't do is that a doula is not a medical profession, should not do any medical procedures. They're there for the physical and emotional support, period. But that is more than enough. Thank you very much for watching, and I hope to see you next time here on our channel, Nurse Aisha.